DocPlus brings you Dr. Bindu Sthalekar, India's leading dermatologist. She has almost single-handedly changed the face of skincare in India, and we just want to thank you so much for being with us today. I might start off with the most predictable question, but I really want to know what was it like? Did dermatology choose you, or did you choose it?
I think a bit of both. Dermatology attracted me, and hence I decided to take up dermatology. And as all of you all know, skin is the largest organ of the body, and any affectation on the skin, it definitely affects the person, the mind, the psyche, and also the skin diseases are very visible. So I wanted to look deeper, study in depth, and then help the people.
What you just pointed out, and rightfully so, you just mentioned about the psychological effects. If I have a skin problem, it will affect me. I will be a little conscious going out, thinking and stuff like that. At the same time, a lot of psychological problems also affect skin. So, could you throw a little more light on it, considering the stressful lives that we all live today?
See, I have been in dermatology practice since a long time. So I have seen that how the lifestyle has changed. Earlier, the lifestyle, there was much more relaxed. There was not so much stress. The diet was very, very balanced. But now, with the factors like there is excess stress, the population has increased, so there is competition. The traffic is there, the pollution is there, so that affects the skin. Now, the stress and the lifestyle I'm including even the diet. The diet, all we are eating nowadays is refined foods. So if we are hungry, we'll just go to I don't want to take any names, but we'll have a hamburger or we'll have, say, a hot dog. But who now thinks of having, say, poha or upma for breakfast? So the lifestyle includes this fast foods which we are eating and the stress. Now this affects the skin. Stress affects the skin. There are certain diseases like say neurodermatitis. As the name suggests, that stress worsens it. We say there are diseases like lichen planus, psoriasis get worse with stress, but there are certain diseases like when you have them, it causes a psychological problem. Like acne, like I'm seeing teenagers and I'm seeing even young women who are so affected by one single acne on the face that affects them psychologically, that does affect them. It makes them so almost go into depression. So this is acne, hair fall. There are so many people now suffering with hair fall. So the moment you mention hair fall, they get very, very depressed. They feel very, very low. Like I'll give you an example. I had just recently a 24-year-old girl who lives in Bombay but who has joined a company in Pune. So when she joined, say 1 year ago, that time she had long hair and she had a head full of hair. But maybe stress and maybe living away from home and maybe the diet what she ate did cause hair fall to her, and she went on cutting her hair shorter in the false belief that when you cut your hair shorter it falls less, which is not true. And she started tying her hair and she started putting a band. Now she came to me with thinning hair and the mother told me that, doctor, she's very, very stressed. When I went deeper into her history, I asked her, I said, we did I believe in doing certain tests, and then I told her that the stress has caused this hair fall. And she said, on questioning, she said that the girls in her office now tease her. When they tease her, she goes into more of a shell. Mother said that now she is going for counseling because this is affecting her mentally. So when I probed and when I questioned her, I told her, see, the stress is worsening it. Now the girls who are teasing you are doing so because you are very efficient and you perform very well. So they are teasing you and they are trying to get back at you. So this is one way of one example that hair fall could also get aggravated by stress, and there are many diseases which get aggravated by stress. And now the latest one is PCOS, that is polycystic ovarian syndrome.
I mean, you just touched upon this topic about, the kind of lifestyle that we are living. It affects our skin so much. Like, what do you think are the most unfortunate word, but popular and the most glaring skin lesions that we've had because of the lifestyle that Bombay, especially, or India, in Indians normally face because of the kind of lifestyle that we are living?
See, as I mentioned earlier, I have been in practice in the last 25 years. Earlier, I used to deal with dermatology, but cosmetology was very nascent. So I've seen cosmetology being developed, how it has come through, and because in my time earlier, there was no courses or there was nothing in India. So I used to go abroad and I used to attend conferences, seminar, go for training, and hence cosmetology by and by I learned the skill. And to keep myself updated, I keep going to conferences, and hence I have brought some of the procedures like botulinum toxin, that is Botox, and fillers. Now these fillers, that is I mainly prefer the hyaluronic acid fillers, which are temporary fillers, and of course nowadays PRP, that is platelet rich plasma. So these are the things now which I have in fact started in my clinic, and I had been one of the pioneers to bring it to India. So this particular area of cosmetology is increasing because a lot of stress is on appearance. So as all of us know that it is ingrained in our heads that people who look better get better jobs, or people who look better, then they are given raises. But I do not agree with that. I always tell people, I always tell my patients that the concept of beauty has an inner package and an outer package. So there is a contextual beauty which I tell them. So the inner package is as attractive as the outer package because it's like a gift. If the gift wrapping paper is only very stunning and very attractive, and inside the gift is not good, the whole thing is going to fall flat. So I tell them that there is a concept of an inner beauty and an outer beauty. So the inner beauty is all the characteristics, your personality, your confidence, your morale, and of course not to forget your peace of mind. That also reflects, and the outer beauty which is there, that is of course to be taken care of, and that is also very important. But I like to tell this to my patients, and I like to tell people who walk into my clinic, is that only external beauty is not going to get you anywhere. It has to be that whole package of inner as well as outer. You may look very good, but what happens if you do not have the confidence, if you do not have the peace of mind? Then nothing is going to work for you. So it has to be a combination of both.
You rightfully said that, we are so fascinated by looking good. Another factor that I think we Indians suffer a lot is this fairness thing. Everybody wants to look fair, that is their idea of beauty, which is rather unfortunate. And I'm sure, in your line of work, there might be many coming up to you and asking, can we become fairer? how do you deal with this? Because I'm sure that you might be having your reservations about this.
I'd like to say over here that this thing about fair is beautiful has been ingrained in Indians maybe since the Britishers came. I don't know how it started, but it has been ingrained in us, and it is very, very unfortunate. And that's why now sometimes I'm glad to see darker beauties. I don't want to take any names, but actresses in India who are wheatish complexion and darker, and they look beautiful. So when there are many young girls who come and tell me that doctor make me fair, so I tell them that again my thing about contextual beauty. India is a land of wheat complexions. So highlight what is given to you. Yes, if your skin is patchy, if your skin has pigmentation, definitely I'm there to treat it, I'm there to help it. But no one can make your skin fair than what is given to you, what is nature's gift to you. So own that. Do not hide it. So own what is given to you, highlight it, and as I always say, you have to have that confidence to say, I am not as beautiful as you, I am as beautiful as me. So I tell my patients that do not stress and do not get stressed about being beautiful. I would like to give an example over here. I have a patient who's about 40-year-old. She's married with kids, very happy marriage, very good kids, everything is good, but still she's been coming to me since the last 10 years saying, Doc, make me fair, make me fair. Why? Because she has a younger sister who was born fair. So as a child, she was always told, you are dark and your sister is fair. So that has been ingrained to her since childhood, and no matter what you do, she looks so attractive, but she still has this thing that no, I want to become fair. And that's when I tell her that look, this whole concept has to change, this whole mindset has to change. With the result, what is happening is that people just go in for creams, and creams, here I would like to mention that creams containing hydroquinone. Prolonged use of these creams, that is hydroquinone, they cause permanent pigmentation. So I tell people that do not apply any of these creams because, or nowadays injections are available which make people fair, but that's only temporary. So what you have to do is, see, can you imagine someone with a darker complexion but a one uniform hue and the skin healthy, glowing, how attractive it looks versus say someone else who's got patchy pigmentation. So I tell them that all you have to do is apply sunscreen regularly so that your skin remains one uniform tone. Yes, no one likes pigmentation, whether it's a fair person or a dark person. The pigmentation is what actually what actually takes away the looks. So prevent the pigmentation by applying a sunscreen regularly, and do not go in for these over-the-counter products which may contain hydroquinone. Refrain from that. In fact, USA has banned the over-the-counter use of hydroquinone. So refrain from using that. And of course, if you are healthy from within, you are going to show that glow. And another favorite sentence of mine is that when people come and ask me, when girls come and ask me, Doctor, I want a glow on my skin. So I tell them the skin is not your leather which is covering your bag and we take cherry blossom shoe polish and we shine it. No. That glow will come from within, and at that time no one sees the color. You just see that glow from within, and you see the attractive features and your confidence which emerges, and that whole package looks so attractive.
Doctor, this leads me to the next question about would you think it is safer for young women who are investing in cosmetics and stuff to at least figure out their skin type? Come to a doctor, check what perhaps they have some allergies which they are not even aware of. Don't you think that that should be a mandate?
Yes, because see now skin types, Indians I'm talking about, we Indians, we do have a share of sensitive skins, though it may be less than Caucasians. But because I always feel our melanocytes, that is our pigment cells, protect us, so we do have the category of dry skin, oily skin, normal, combination, and even sensitive skin. So suppose someone without realizing it is using, say, cosmetics which have cream. So when they are using it on the face, and if the girl or a boy is prone to acne, so the creams will block the pores and they will start acne or trigger acne. So you have to be told what is your type of skin, what type of cosmetics will suit you. Like I always say that patients with people with oily skins or acne prone skin should use non-comedogenic products. That means the products do not block the oil pores, and they should use gel-based face washes, versus people who've got dry skin or mature skin, then they should use creamy washes. And people with cosmetic skin, of course, with combination skin can use a combination of this, but sensitive skins have to use products which are hypoallergenic, because that will cause a problem on the skin. But irrespective of what type of skin you have, I want to tell everyone that they must use a sunscreen, because we Indians most likely will not get cancer. Like I always say, this I have faced before in my 25 years of practice. Earlier, I never used to see so much of pigmentation, but now I do see pigmentation because ozone layer is being depleted. So you have the UVA, the UVB, and of course little bit of UVC rays also coming through. The UVA rays, that is the ultraviolet A rays, cause aging. The UVB burns the skin. UVC, a minimal amount now, but as more and more ozone layer gets depleted, the UVC layer, the rays cause cancer. And if more and more rays are coming through, as all of you know, the CFC is being depleted. So obviously more harmful ultraviolet rays are coming through. And now I am seeing more of pigmentation, what we call melasma, which I never saw some time back. So irrespective of what type of skin you have to use a sunscreen. But I have patients telling me that, doc, I don't like itchy pitchy on my face, it is very icky picky. Again, I would like to say that many years ago there were no sunscreens. So I would say just apply calamine lotion or go abroad and get it. But now we have a wide variety of sunscreens available. Oily skin, go for the gel. Dry skin, go for the cream. Always make sure that you apply adequate amount. 1 teaspoon is the adequate amount of sunscreen. It should be applied 10 to 15 minutes before you step out. And if you're out in the sun for a longer period of time, you have to reapply every 3 hours. You're not going to get pigmentation. So that's one of the ways to stop the pigmentation. And prevention is always better than cure.
One more thing about, there's so many patients that you treat every day, and yet there are some who assume that they have a lot of problems. They already tell you that, I think I have this issue. They want a treatment for perhaps a problem that does not exist. To tell them that, to undertreat somebody who wants to be overtreated. how difficult is it, and does it, like, what are the difficulties that you face with these kind of patients?
See, I believe my one principle is a happy patient is your patient forever. And another motto I have is that educate everyone, educate my patients. So when the patient comes to me, when a person comes to me, I explain everything to them. And if they tell me that, doc, I'm looking 40 but I want to look 16, so I tell them that is not possible. I could do that. I could fill them up so much. I could Botox them so much. I could do lasers so much. But I said it is going to look artificial. So you have to look your age, but you have to look your best, whether you're 70 or whether you're 20. You have to look your best. So this is my motto. And if a 40-year-old comes and tells me that, doc, I don't want a single line on my face, I sit and tell them that it is going to look very artificial. I do show them some say pictures, and now you have apps where you can modify it and you can show it, and they themselves realize that it will look very artificial. After my treatment, I tell them that everyone, like whatever treatment I do, whether be it skin treatments, be it fillers, be it Botox, be it anti-aging treatment, I always tell them the comment you will be passed is that everyone will notice, wow, how good you look, but no one will know what you have done. They will all presume, and you can also tell them, oh, I had a good holiday, I slept well, or I did a course of meditation, or I went to a spa. And this comes that when the results make you look natural and not artificially overdone, this is generally the result which I give to all my patients or everyone who walks into my clinic. This has been my principle.
One more, perhaps predictable question once again, is about, we spoke about Botox, and a lot of non-medical personnels are also recommending it, even injecting sometimes. You go to parlors and stuff like that. This is a concern. There are so many people who have suffered because of such kind of, uh, practices. What do you have to say about it? I mean, I'm sure that this must be a very big concern. How do you deal with it?
Yes, this in fact I feel that we should have stringent rules, and this should be, I don't know whether the government should look into it, but this should be looked into it. First of all, the concept about lasers, botulinum toxin, fillers, all this should be done by an experienced dermatologist, and it should definitely be done under medical supervision. Now, things like Botox, things like fillers, they are very safe when they are done by an experienced dermatologist. But if done by inexperienced, either, I mean, as you mentioned, that not even doctors or in parlors, if they are doing it, that is a road to disaster. So stringent action should be taken. And here I would also like to comment that I have so many people who now are being given advice by, say, when they go to the gym, they are given advice by XYZ people that, okay, and nowadays they all go for muscle building or they all are exercising. So they are being given protein supplements. But I would like to say over here, and I would like to tell everyone, normal intake about proteins for a normal person is 1 gram per kilo body weight. So if a person is, say, 50 kilos or 60 kilos, we should have about 60 grams of proteins. But if we are doing any heavy muscular activity, it could increase it a little bit more. But you'll be surprised. I had a patient who came to me and told me I'm taking 120 grams of proteins. So I was aghast. I said, what will happen to your kidneys? Your kidneys are not equipped to handle so much proteins. Number one. Number two, excess proteins also cause they play havoc with your hormones. So there is always an increase of male hormone. So in a male person, the male hormone is going to cause acne, is going to cause hair thinning. In a woman, in young girls, it's going to cause acne, is going to cause excess of facial hair, hair thinning, and it may trigger PCOD, that is polycystic ovarian syndrome. So all these things, and now when they get acne, they are being given medicines like isotretinoin. Isotretinoin is a derivative of vitamin a very safe medication if given in experienced dermatological hands, but if given by inexperienced people to a Tom, Dick and Harry and a Joan, Jane and Mary, you can get disastrous results because it should be told that it has its own side effects. Blood tests have to be done before, and also it should be given with great caution to women who are married and who have the childbearing potential. You cannot get pregnant while you're on isotretinoin. So all these things, the stringent actions we have to take, and I hope one fine day that education, that's why I say education of the people, and anyone who walks in is always told the pros and cons of everything. So they can go and tell 10 other people.
Very true. You know, a lot of, given, and you just mentioned all these things, at the same time, cosmetology as a segment is often associated with vanity. It is completely disregarding a lot that a doctor actually does. So I would really like your comment and your insight on this.
See, as I mentioned earlier, that cosmetology, or people who feel, oh, she's a cosmetologist, that means she's just going to just do Botox and fillers. It's not so. There is something called, like when someone comes to me, as I said, I start from the cover, that is your skin. So not only I look at the quality of your skin, the texture of your skin, the pigmentation on your skin, and if your skin is hydrated, dry or not. Then I go on to lines. What lines do you have? Then I go on to see how much fat you have lost, and all these things are taken into account, and I do not treat a person only one single line or one single aspect of your skin. The person is treated holistically. Suppose someone comes to me, say with acne, or the person comes to me, say with some lines on the forehead. So if a person comes to me with acne, as we all know, there is a puberty acne. So at puberty, you get acne, it starts at the age of 13, 12, 13 and it ends at 18. But nowadays, as I mentioned, there is stress, there is lifestyle changes, and people, some of them over-exercise, some of them don't exercise. So this has its own hazards, triggers hormonal problems. So when say a woman or a man of say 30 comes with acne, I just don't treat only the acne. I also look behind. My favorite sentence to everyone is that skin is only a reflection of your internal system. If your internal system is healthy, your skin is going to glow and everything is going to be fine. You will not need me. So I always feel like, say, a simple thing like acne. So acne in a 30-year-old always has an internal cause, and that could be, say, stress. The stress triggers, we have the adrenal glands, they get triggered or they get stimulated, so they release stress hormones, which causes androgen release, which causes your oil glands to enlarge. So by just treating the acne, after 2 months the person is going to come back that, doc, my acne is not gone. So you have to go, I always go into the deeper aspect, look into the deeper aspect of the cause of it. If she has stress, then I treat her holistically by telling her, okay, what is the cause? If we can help with the cause, or meditation. I recommend a lot of other alternative treatments like meditation.
What do you think is, according to you, is the commonest problem that a dermatologist faces today when it comes to our patients, of course?
Nowadays, I have seen one thing is that this I faced earlier, and even till today, things have not changed much. That is because people have this belief that the answer to all their skin problems is a topical steroid cream. With the result, there is almost an epidemic of fungal infections which I am seeing, and it has risen to such proportions that it is now almost like on a war footing. We have to treat it. We are seeing all family members in a house getting affected. We are seeing many of these fungal infections which are resistant to the normal drugs, which are antifungal drugs which are available. So in fact it is a problem, and I would like to give a few cautionary words over here, is that the steroid cream, topical steroid cream, should not be applied without a doctor's prescription at all. In fact, this should not be given to anyone and everyone freely by the chemist. That is because when we apply steroid cream, A, it thins the skin. B, what it does, it facilitates any infective organism to spread. So hence, as I said, we have like the fungus spreading everywhere, almost to the whole body and to everyone in the family. So this should be refrained upon, and people feel that if I apply a steroid cream on the face, there are many girls who've been applying steroid cream on the face who initially may get a good glow, but later on the skin thins, they start getting acne, and they start getting what we say red blood vessels which are prominent. And this, I have to tell you, I had a patient who saw me about 10 years ago, a young girl who was about 18 at that time. She had an issue, she had a little allergy, and she started applying a steroid cream, and she continued applying it. She came to me 10 years later, she had glaucoma. That is because the ophthalmic surgeon told her that is because of the prolonged use of steroid cream which she was applying for the last 10 years. So here I would like to stress that please, I would like to tell everyone, do not tell the patient to apply steroid cream. Refrain from them using it without medical supervision. This is almost reached an epidemic proportions.
It's really scary. Another factor, when it comes to patients suffering from diabetes, even cancer, a lot of them, it leads to a lot of skin problems too. At that time, perhaps, you are not really concentrating on the skin problems that you're having, but at the same time, those are really equally important sometimes. So, how do you deal with that?
See, diabetes per se, we all know the sugar goes up. So we all know that they are prone to folliculitis, that is, they are prone to bacterial infections, they are prone to fungal infections. So they have to look at that aspect, because if there is a simmering infection, any infection on the body in a diabetic, if it's a bacterial infection, if it goes out of proportion, it can raise their sugar levels. Secondly, people who are diabetics, I also always advise them that always check your feet at the end of the day, at night, because some of the diabetics do have what we say peripheral neuropathy. That means they have decreased sensation in the soles of the feet. They do not feel anything. So if they've got a cut, if they've got a thorn, or if they've got an injury and they do not notice it, do not feel it, that will get infected, and that infection has known, we all know as doctors that can play, that can be disastrous, because the infection can just spread everywhere. So this is another very, very important lesson for the diabetics. And here I would like to say that for people who are pre-diabetics, now, as I mentioned earlier, because of the stress, the lifestyle changes, and because of, if some people do hardly any exercise, lifestyle changes in the sense, what I mean is that having the wrong diet, refined foods what we have, then what happens is that there is an entity called insulin resistance. Some years back we did not have a lot of knowledge on this. Now more and more we are coming to know about this entity, insulin resistance. And as I mentioned to you earlier, skin is only a mirror, it's a reflection. And if you are astute, if you are quick at picking up the signs which the skin shows, then you can help the person going into frank diabetes. I'd like to give you an example over here. Many a times a man or a woman will come and tell me that, doc, my skin on the face is getting darker. I hardly go out in the sun and it's getting darker, it's getting pigmented, and they have darkness on the folds, that is on the neck or underarms. Many a times they'll say, oh, but I clean myself, but still I have these darkness in my folds. So I tell them that's not dirt. So don't go on scrubbing it. It is actually pigmentation, and this is a sign of insulin resistance. That means that person is a pre-diabetic. So if they come to me with those signs, that is excess pigmentation or darkening of the skin or darkening on the folds, I ask them to do certain blood tests, and if their insulin levels are high at that time, their sugars will be low but the insulin levels will be high, then we can prevent them from getting frank and full-blown diabetes. So as I said, look at your skin, pay attention to your skin. Coming to cancers, of course, I hope no one ever gets it, but if they do, you still have to look at your skin, because your skin is also suffering from the radiation. If the person is undergoing radiation, if the person is undergoing chemotherapy, their skin becomes dry, their skin becomes pigmented. So they have to look at their skin, they have to pay attention to it, they have to use a sunscreen. They also get hair fall because of chemotherapy or radiation. This is totally reversible. So what I want to say is that you don't have to lose heart, but you have to take preventive action. At that time, if you take preventive action, then okay, you are going to go into for chemotherapy, so you may get hair fall. So some measures can be given to you, say some vitamins can be given to you, which will prevent this. So you should look into it and you should not just neglect it.
What, according to you, has been the greatest breakthrough in dermatology today, especially in India?
Okay, especially in India, see, with with diseases like psoriasis, with diseases like we have one hidradenitis suppurativa, that is like very bad acne-form lesions in the underarms and the groin, which is very psychologically debilitating for the patients, for the people. Then, of course, very chronic, intractable urticaria. So we have biologics. Now, with the advent of biologics, of course, they are safe if they are given under proper care, guidance, with the proper tests which are taken. They are a boon to people. Like, I have people who got generalized psoriasis all over the face. So all over the face, the body, and as you know, they do not want to go out. They have, they face something called body shaming. So we have biologics now which help to take care of the lesions. And these are one of the, I would say, great breakthroughs in dermatology. So now we can definitely treat the patients with them. And another breakthrough we've had is lasers. Lasers of various types, we have lasers of various types, but in dermatological practice, we have lasers for pigmentation. So if someone has got pigmentation like melasma, like if the pigmentation is what we call as ephthalites, that is freckles, lentigines, we have very safe lasers. And here I would like to mention, like I'm talking about lasers for pigmentation. Now we have lasers for tattoo removal. Someone had a girlfriend and they printed their girlfriend's name on their arm, and now they are getting married or they've changed the girlfriend. Well, we have lasers to remove those tattoos. So you don't have to go in for surgeries and get bad scars. Then we have lasers even for acne scars, bad acne scars. We have lasers for keloids, and these are very, very safe. So these are real great breakthroughs, and so nobody has to go under the knife. Hardly anyone has to go under the knife or go for surgery, because these lasers are almost like an OPD procedure.
You have a lot of celebrity clientele. When you're dealing with those, I'm sure that you're not only dealing with their skin, you're dealing with their careers, their image, the entire thing. It's a very handle with care kind of a situation. Uh, what are what have been your experiences so far, and what have been the greatest challenges that you've faced?
Okay, now for celebrity clients, like I feel everyone is a celebrity and no one is a celebrity, because I value everyone who is coming into my clinic, be it a millionaire or be it a person who is working as a sweeper in my clinic or in my building, because I always feel if you value, if you respect your work, so there's nothing like shame. That is one thing, and hence I run a Seva clinic in my both the clinics since the last 5 years. So that is for economically challenged people, because whom will they go to? That is one. Now coming to my celebrity clients or celebrity patients, now one motto I have is that never give the names to anyone who walks into my clinic. So the celebrity, one thing they are worried about, I do not want anyone to know that I am coming here for a treatment, be it a skin treatment, be it acne, be it psoriasis, or be it collagen vascular disease, anything. They do not want anyone to know. So that is followed very, very strictly by me and my staff. So that is number one. And that, I think, we have taken the Hippocrates oath. So we all, I'm sure, do that. And secondly, the celebrities also, yes, what they want is, they ask is that when they come in, they don't want anyone to see them. So, okay, these things we try to pamper them. And another thing I have faced in treating them is, like, if I'm talking about cosmetological treatments, I'll give you an example. Like if say an actor is worried about the lines on the forehead or crow's feet, that, because when you have lines on the forehead, they make you look angry all the time. So I tell them that if I take away those lines fully and I make your forehead smooth and I do not allow you to have any crow's feet, so when you are emoting on the screen, you're going to look very artificial. No one is going to like what they see, a smooth forehead. It may look good, but it's not going to convey the emotions. So I always undertreat them. I make sure that I do not go full overboard, undertreat them, make them understand that less is more, and they're happy with it.
There are another thing, steroids. There have been a lot of myths surrounding it. Could you just put some light on it?
Topical creams, as I mentioned earlier, is hazardous. It should not be given prescribed by anyone but a dermatologist for the right reason and not for any other reason besides, say, an allergy or if they have broken out into a rash. But that too, because rash can be of various types. You can get a rash because of a bacterial, you can get a rash because of a viral reason. So it has to be a dermatologically prescribed steroid cream. Coming to oral steroids, yes, that this is another avenue, this is another aspect of practice, is that you have androgenic steroids people are taking who go to the gym and they are given those steroid tablets to build muscle. And as I mentioned earlier, they have their own problem. Women, girls, if they are being given androgenic steroid, you're sure you're going to have excessive facial hair, excessive body hair, you are going to get acne, there is going to be hair fall, because these are the products, these are the fallouts of excess androgen in a woman. Even in a man, excess androgens are going to play havoc with your hair, with your skin. And of course, if I am talking about now the corticosteroids, those steroids, if they are given for the right reasons, perfect, because when they are meant to be given, they are lifesavers. If someone has come to me with a drug reaction or a Stevens-Johnson syndrome, yes, the only thing that will help him is a oral steroid. But if they are given steroids for, say, to make my skin glow, or there are many people who are given steroids if they've got a rash and they are given oral steroids. So this, I think the rule should be that the chemist should not allow any OTC or over-the-counter delivery of steroids, and a prescription has to be there.
Men, as opposed to women, don't seek dermatologists as easily. I mean, that's perhaps a misconception. You might want to correct me there. But do you think that there is an issue over there?
Earlier, much more, men would hardly walk into a dermatology clinic. They would walk in if they had any dermatological ailments. But if they had any complaints, like as I said, anti-aging, they would feel that no, it is below my dignity to go to a dermatologist for anti-aging. But here I'd like to correct is that I always tell anyone who walks in that we are not going to make you look 20 years younger, but we are going to make you look your best. You may be 40, but you may look 60. So I'm going to make sure that you will look 40. If you are 30, I'm going to tell you the preventive measure, how to take care of your skin. Because nowadays, an ounce of prevention goes very far. So I'm going to tell you, I'm going to guide you how to prevent aging at a very rapid rate. Because stress, sun, these are the highest factors for aging. So I also, as I said, will educate the people who come in. So males want to look their best, but they feel that if I do these treatments, it's against my vanity or it's against my motto or against my principle. But that's not so. It is only to maintain what you are and to teach you preventive measures. So this is how it's going to go a long way.
A lot of stress is upon cleansing, especially in the nights and all. But a lot of times, I mean, it is said that we do it wrong. We over cleanse or we just use really harsh products. Would you be able to share some of your insights on that?
So coming to cleansing, of course, I can give many examples. I've had my fair share of people saying that, Doc, I don't use any soap or any cleanser or any face wash on my face. So then I asked them, do you use on the body? Yes. So I said, isn't the skin a continuation on the face? So then they said, oh yes, but I thought that if I use soap or if I use face wash, that's going to age me or that's going to cause pigmentation or anything. That's not so. There is a lot of pollution. There is a lot of, as I said, sun. So cleansing is as important as if you're washing your body. Soaps can be used, but nowadays, as medical science is advancing, these are pH balanced. Earlier soaps were not pH balanced, they were alkaline. So they used to make the skin very dry. Now the soaps, the bar soaps or face washes are pH balanced, the pHs. So that does not make your skin dry. But at the same time, we need to wash off all the dirt, the grime and the pollution. When we are going out, we have all this on our skins. So we have to wash it off. Then I had my fair share of people. The other day, one 20-year-old boy came with acne and said, Doc, I wash my face 20 times with a face wash, but my skin still gets oily. So it's going to get oily because you should wash your face twice or maximum thrice with a face wash or a bar soap. Why? Because if you wash it 20 times, what you do is you are rubbing your skin. You are putting pressure on your oil glands to secrete more oil. They are getting stimulated, so they are going to secrete more oil. So it is a futile treatment. It's a futile whatever you're doing. You are just going around in circles. So that is what I told that 20-year-old. I said, wash your face twice or thrice in a day and pat your skin dry. Do not rub, do not press. That is one. And secondly, they also feel that sunscreen, that's another myth which I have faced, that they feel I don't want to apply a sunscreen because it makes my skin itchy pitchy. So I tell them that you have to apply a sunscreen. And the cleansers, then another thing used to be toners. This was very, very popular earlier. But if the person has got, say, oily skin, then they can also use an exfoliant. When they use an exfoliant, you have nowadays a lot of varieties. You have exfoliant washes which have small like beads inside and they exfoliate your skin. So oily skins can just use that and that unblocks your pores and that removes the collection of the dead cells in the pores. So if that is used, say, twice a week, or if somebody has got normal skin, then just once a week. So now we have array of cosmetics, but you have to know what to treat and what to use, and you have to use the right product in the right way.
Thank you. I think you've answered all our questions, and we are really, really glad that you took the time out to do so.
Okay, here I am going to add one more thing, if I may. A quote is that my mantra for treating a patient is, especially dermatology, is that we have to treat them holistically and not just the symptom. So as William Osler said, a great physician treats only the disease, while a greater physician treats the whole patient. And I hope we all follow this.